My name is Ross Fargnoli. I'm currently an outpatient orthopedic physical therapist and the spine team leader for Good Shepherd Penn Partners Physical Therapy, which is the official therapy provider for Penn Medicine. I've been with the company for about 8 years now. I graduated from what was once University of the Sciences in 2015. And upon graduation, I completed an orthopedic residency at Good Shepherd Penn Partners. And soon after that, I completed a 2-year fellowship in orthopedic manual physical therapy through Regis University in 2020. So after graduating from physical therapy school, I was confident that I wanted to treat an orthopedic patient population. However, I wasn't very confident as a new grad in my clinical skills or my ability to manage the more complex patients on my own. And in PT school, I feel like I was really prepared to be more of a generalist so I could pass my boards, but I knew I wanted to be more of a specialist, specifically in orthopedics. And for me, residency training provided the opportunity to be surrounded by experts who were both qualified and willing to provide the specialized mentorship that I was looking for. So I think the biggest benefit and the reason why most therapists pursue a residency is for the opportunity to improve their clinical skills and their clinical decision making, especially in a specialized area of practice. So for me, this was orthopedics, but there are a lot of different residencies out there, including neurology, sports, pediatrics. So depending on the area that you are most interested in, there's typically a residency out there that you can pursue. And with the improved clinical skills and decision making, the biggest benefit to me was building my confidence as a clinician. So with a residency, you have that dedicated mentorship and guidance in the clinical setting, which helps with managing the more complex patients. Especially as a new grad, this can be one of the most challenging things as you enter your career. And with this improved confidence and improved clinical decision making, you're also going to notice improved patient outcomes, and you're going to become more efficient in the clinic. Another benefit to the residency for me was the opportunity for networking. So you have an opportunity to meet other residents and mentors, which opens up opportunities to become involved in other post-professional career building opportunities, such as teaching, becoming involved in different con ed courses, and potentially research if that's where your interest is. So for me, completing a residency and the board specialty certification afterwards helped me climb the career ladder within my company more quickly than my peers with the same number of clinical years of experience. So most companies will offer either bonuses or opportunities to grow into leadership roles more quickly for therapists who have completed some type of post-professional education, such as a residency or a fellowship. A residency for me also opened up, as I mentioned before, a lot of opportunities to participate in teaching as an adjunct at University of the Sciences, and also as a participant and leader for different continuing education courses. It opened up opportunities for me to become involved in conference presentations and different research publications and presentations, which is something that I personally am interested in. So I think one of the most important things to demonstrate on your residency application is a commitment to one specialty area that you're applying to. So it can be a red flag for residency directors that are reviewing the application if they see that you've applied to different specialty areas such as orthopedic and, let's say, neuro residencies. So speaking with different residency directors, this is a flag because it shows that you aren't really sure what you want to do with your career and you're not really committed to one specialty area, which is very important for someone that's going into a specific residency. Another big thing that I think is important for students to consider is building your CV as a student to make sure that your application stands out from your competition, which oftentimes is other new grads or even therapists who have been in the field for a little bit longer. So becoming involved in different research opportunities as a student when completing your capstone project, and also participating in different continuing education courses as a student in the specialty area that you're interested in can help you stand out on your application. I think the last thing that's important to consider is seeking out strong letters of recommendation. So it's definitely helpful if during your clinical experience or even interacting with professors that you get a letter of recommendation from a therapist who has specialty training or has completed a residency and fellowship themselves, because they can support your commitment and your readiness to participate in post-professional learning based on their experience. So the program I completed consisted of a total of 45 hours a week. So 35 hours of dedicated clinical care and 10 hours of dedicated residency time. The dedicated residency time was spent mostly practicing manual therapy skills with mentors, shadowing mentors as they managed patients, and also co-treating patients that were more complex with the guidance of a mentor. Every residency program also has a didactic portion. So the program that I was involved in involved mostly watching pre-recorded lectures and attending live lectures that were delivered by mentors, and also discussing assigned articles that were assigned for each week. So when I was looking into different residencies, the location was important to me. So most of the residencies I applied to were within the Philadelphia area. The good thing is that there are a lot of hybrid university-based residencies now that allow for a bit more flexibility and can be completed remotely. So the residency I completed was all in person. However, there's other programs that are more asynchronous, self-guided learning models where you can complete them remotely and then attend weekend intensives and seek out mentorship on your own. I also had to consider the financial burden of completing a residency. So Good Shepherd Penn Partners residency was my top choice because for this program, they hire you on as a full-time paid employee with all the benefits that a full-time employee would have, with no additional fee associated with completing the program. The only catch to that was they require you to stay with the company for an additional year after completing the program. But for me, I saw this as a benefit because I wanted to be part of a hospital-based system such as Penn, and I could see myself staying employed with this company and growing within the company like I have. So with hospital-based residency programs, they oftentimes will offer more opportunities for physician shadowing. So this was built into the program that I completed, both shadowing physicians in the clinic and also during surgery, which I thought was really interesting. At GSPP, residents are also involved in teaching as preceptors for Penn medical students, where the physical therapist and residents run an orthopedic lab for third-year Penn medical students, which I thought was a really great opportunity to interact with physicians, both teaching and also for networking. Many of the mentors at Good Shepherd Pen Partners are also involved in different research projects themselves. So depending on your clinical interest, there are oftentimes a lot of opportunities available to become involved in research, especially when part of a larger university-based hospital system such as Penn Medicine. Yes, I did reach out to faculty, and I think reaching out to the residency director and talking to previous residents is very important. I also highly recommend shadowing a current resident or one of the mentors so you can get a feel for the environment, and also you can introduce yourself to the staff. This is going to help you stand out from other applicants who didn't do this, and it's also going to show the residency staff that you're interested in the program, and you can ask questions and see if it's the right fit for you. As I mentioned, one of the benefits to the residency I completed is that you're hired on as a full-time employee with full pay, with just a commitment to stay with the company. But unfortunately, this is not usually what happens. This is pretty rare. In my experience, most hospital-based residencies will hire on the resident with partial pay to cover the cost of the program. Most of the private practice or hybrid university-based programs are almost always going to require a fee to complete the program. But I know with student loans, there's a way to defer the loans while in an educational program. So that's also something to consider.